Now, in recent weeks, we've seen some cluster of measles in the Memphis, Tennessee area. I think there was about 7 cases there. And more recently, in fact, today, the Arizona Department of Health says today being Thursday, when I record the program, say that they've confirmed 2 more cases of measles, bringing the total in the Pinal County, Arizona area to 13. So joining me now to give us a primer on measles is Erin Archer Kelser. Erin's a registered nurse, an infection control specialist, and a freelance writer. Hi, Erin. Welcome back to the program.
Hi. How are you doing, Robert?
Oh, so glad to have you back.
Thank you. It's good to be back.
Okay. Well, let's go ahead and start out with the basics of, what is measles? And then can you give us a history of measles in the United States?
Sure. Measles is a virus. So it's, of course, antibiotics won't work against it or anything. It was a very common illness, usually of childhood. Before the 60s, most people had it by the time they were 15 or so. And the vaccine became available against measles first in 1963, and then a different version of that vaccine in 1968. But before vaccination, about 3 to 4 million people in the U.S. were infected every year with measles. And 400 to 500 people died, and about 48,000 people were hospitalized, and 4,000 suffered encephalitis from it. So it was significant, but it was generally a disease of childhood that we have vaccination against now. And since we have mounted successful vaccination campaigns against it, it has dropped progressively. It used to be that people got 1 measles vaccine, and then 1989 outbreak prompted, family medicine and pediatric specialists to recommend 2 measles vaccines. Since 2000, we haven't had ongoing transmission in the U.S. It's, what they call eliminated.
Right.
So that's what we're trying to get back to. The cases that we've had in the U.S. have been started by someone coming from overseas.
Okay. Now, how do you contract measles? And can you describe, this is a very contagious virus. Can you describe how contagious it is?
Yeah, it's, you contract it either by breathing it in or by touching things and then, touching your mucous membranes, your eyes, your mouth, things like that. Some things that you breathe in, like say whooping cough, it's droplet transmission. If someone coughs or sneezes within a few feet of you, you breathe it in. But those droplets are big and heavy and they fall to the floor. So if you're not close to that person, you're okay. Measles is airborne, like tuberculosis is airborne. So the virus is small, it stays aloft for at least an hour. And the CDC says to be safe to think 2 hours on surfaces and in the air. So just shared airspace with someone, if you're susceptible, it's going to infect about 90% of the people who are exposed to it. So it's very contagious.
Now, after someone becomes infected, how long till you start seeing the typical symptoms?
Well, there's earlier symptoms, and then there's other symptoms that we think of as typical. Like people, often think with measles they think a rash, right? But the rash doesn't show up until about the 5th day of illness. So after you're exposed, some people, people develop a crummy viral syndrome about 8 to 12 days later. And, they can have a fever. They can, have what we call the 3 C's of measles. So that's cough, coryza, which is like a runny nose, and conjunctivitis, which is red eyes. Those are very typical in measles. Some younger children will get infections in their ears, otitis media. And then the rash will often show up about 14 days after someone has been exposed. And that rash is, unless someone has, immune compromise or something, tends to be very typical in how it presents. People will have this, that viral syndrome for a few days, and then their temp will spike and a rash will emerge. It usually starts at the hairline and spreads down and out. And it'll be these individual red spots that can kind of gradually grow together. And then as the person gets better, the rash will disappear in the same order that it showed up, and the skin may peel and things. But there's also one of the things that is looked for in measles is they're called Koplik spots, and they're on the inside of the cheek, and what's called the buccal mucosa. You get these whitish areas with kind of a bluish center, and those are considered kind of specifically diagnostic of measles also.
So after somebody becomes symptomatic, how long do the symptoms last, and how long are you contagious?
Then you're contagious for, we usually think of the contagious period as being the day the rash shows up, thinking of that as day 0. And you're contagious for the 4 days before the rash showed up, as far as who we're going to try to contact for who may have been exposed, and 4 days after the rash showed up. So there's a 9-day period there. People can be sick, depending on how sick they get, for a week, or if they get pneumonia or encephalitis or something like that, they can be sick for longer.
Now, is there a specific? Let me talk about the complications first, because not everybody just gets the simple rash and so on and so forth. There are some complications that can happen. How bad can it get?
It's going to tend to be worse for people under 5 or over 20 for some reason, and I've been told before that they're not quite sure why that is. But it can get as bad as like encephalitis, where your brain swells, and it can cause blindness or deafness or seizures. About a fourth of the people who get measles will need to be hospitalized, and usually the main cause of hospitalization is going to be pneumonia. And at least in the Western world, about 1 to 2 out of 1,000 will die from it who are infected. And another complication of measles that, they're starting to find out more about, it'll be interesting to find out, is I had been told anecdotally before by people that after they got measles when they were kids, it was like they got everything that came around for a couple of years. And they're starting to look at what's called immune amnesia, that measles seems to also leave you more vulnerable to other diseases. So, like, for example, when I was doing some research on Shigella, or what's commonly called bacterial dysentery, one of the leading risk factors of dying from it, which it kills 700,000 people a year, is having had measles. And probably because these people were less vulnerable as far as their immunity goes. But yeah, it kind of, immunity that you have built up, there's some thinking that measles triggers some kind of amnesia about that. And you have to rebuild that. So it can leave you vulnerable in that way too.
Yeah, and you talked about the deaths in the U.S., which is, you said 1 or 2 per 1,000. And clearly that number is astronomically larger if you go to a developing nation where they don't have our type of health care and the like.
Right. If you think of like 25% of the people, even, fairly, well-fed Americans with good health care and contact investigations and stuff. If you think of 1 in 4 of them needing to be hospitalized for this, you can imagine what this could do in a low-resource setting that's crowded.
Sure.
And like, things like refugee camps, things like that is always a concern.
Right. Now, is there any specific treatment for measles? It is a virus.
Mm-hmm.
Yeah.
Mm-hmm. So there isn't per se.
Right.
There's post-exposure prophylaxis, where if the cases are caught early enough, they may be able to be vaccinated, and hopefully that will head it off at the pass. Or if they can't be vaccinated, get immune globulin. But otherwise, it's going to be symptom management, or treating some of the things that happen as a result of it, like the pneumonia or the encephalitis, things like that.
Okay, well, let's go ahead and talk about. Yeah, I mean, on my website, I cover a lot of bases, and the 2 topics that generate the most comments, the most controversy, are the MMR vaccine and Lyme disease. Those are the 2 most controversial topics.
Really?
Yeah.
Okay.
I get a lot of comments on that stuff. So let's go ahead and talk about the vaccine. How effective is the measles vaccine?
It depends on how many you've had. Like I said, in 89, they decided to, after the 89 outbreaks, they decided to recommend 2. So the current thinking is that with 1 MMR on board, that it's about 93% effective. And that with 2 on board, it's about 97% effective, which, is pretty good.
Yeah.
If you think about, as far as like worldwide vaccination, in 2000, it killed, over 700,000 people worldwide. And in 2010, in only 10 years, that had been cut down to 160,000. So, vaccination works, but, it's still going to be, with something this contagious, it's going to be a numbers game,
Right.
Because if you think of, say, remember this is airborne. So if you think of, say, someone going into a Costco with 100 people in it at the time, or the hours afterward, 7 of those people who breathe that in could be vulnerable to it,
And what explains that? They have something with their immune system, or the vaccine didn't take with them, or?
Yeah, and I'm not expert in why. Some vaccines don't work for some people. I mean, they've even found people who had circulating levels of IgG, the protective immune globulin, who were positive for that, who still got measles too. And I've seen that happen. So I'm not sure if they're totally sure why that is, and I'm not a measles vaccine researcher. Some of it is that as far as herd immunity goes, we would all be better off if the herd immunity was over 95%.
Right.
The less people we have spreading it around, the less people we have spreading it around to other people.
Erin, can you explain to the audience what herd immunity is?
Sure. Herd immunity is, the immunity that we have as a group. So if herd immunity is the protective immunity that we have. So like some people can't be vaccinated, either because they have immune system problems, or they have cancer, or they're pregnant, or they're under a year old, and so they aren't given this vaccine. So it's incumbent on the rest of us to develop a herd immunity to protect those members of the herd who can't be vaccinated, so that we don't have a bunch of virus circulating that could infect people.
Right. Okay, I'm sorry to interrupt. Did you want to finish your other thought?
No, that's okay.
You're good. Okay.
I know that there has been some people have thought that we may need to develop a new generation of measles vaccine. But I haven't heard of like active efforts to do that. But like I said, I'm sure that the measles vaccine researchers are looking into that. Yeah. But not all vaccines work for all people.
Right. Yeah, I've had different experts on this stuff who daily work with vaccines, like Paul Offit and others, and they say that the measles portion of the MMR and the rubella portion of the MMR are spot on, but there are issues, of course, with the mumps portion. Okay. Well, on your website, germnurse.com, you published an article during the height of the Disneyland measles outbreak last year. It was a Disneyland measles outbreak, I believe.
It was.
Yeah. And you explained this one question. I want you to go ahead and explain this to my audience. Why is one case of measles a public health emergency?
Okay. Yeah, I had been interested in that question since I studied for my certification and infection control exam. That was one of the questions, and the answer was measles, but it didn't say why the answer was measles. And I was born in 1969, and I had never been through a measles outbreak until working in Southern California at the time of the Disneyland outbreak. And it became clear to me that measles, okay, not only is it extremely contagious like we were talking about, but it's very deadly if it reaches the wrong person, someone who's pregnant, someone who's immunocompromised, infants, like I said, who are unvaccinated. And there's a very small window to try to reach all these people who may have been exposed. Because if you can get to those people, you have 72 hours after that exposure where you could give an MMR vaccine, which would be the best, most cost-effective, efficient way to handle it. If you don't have that window, then you have 6 days from the time they were exposed to that person to give immune globulin. If they need it because, again, they're an unvaccinated child, they're immune compromised, they're pregnant, something like that. So there's this very short window to act, and a lot of it has already been taken up by the fact that people have usually been contagious for 4 days before they even begin to suspect they have measles, because the rash hasn't shown up yet. So 4 days are killed already. And so there's this full court press at your local health department when there is a measles outbreak to try to get the word out and try to contact, vaccinate, check the immunization records, get titers, all this on everybody as quickly as possible. Also because if someone is a healthcare provider, 5 days after their first exposure, they need to be, or a child care provider, they need to be, not go to work, until 21 days. So you need to get those people out of the mix and determine that right away. Close contact, same thing. They may need to be quarantined. So there's a lot of labs, there's a lot of vaccines, there's a lot of quarantine orders. And with, each reported suspect case, this can be hundreds of people. Again, someone who went to Costco, someone who goes to college, someone who works at a bank, or someone who is in an urgent care waiting room. It gets very involved. It's really time sensitive, and you don't have the lab results you need right away. So, there's oftentimes genetic testing is done now. What are called PCR tests on the throat and the urine, and if those are performed in house by your county, that's going to help determine who is and isn't a case faster than trying to draw blood on a lot of people and sending it out. But until you know, you have to treat everybody like they are a measles case, just in case. So it gets, very labor intensive. It gets very expensive. You want to keep it away from the people who, it could do the most damage to, like I said. And also it has been eliminated in the United States. So we want to try to contain any outbreak as soon as possible so it can't gain a foothold for ongoing transmission again in this country. So when public health departments are really overwhelmed by outbreaks, it makes it really hard for them to do other parts of their job. If all the resources are going toward a measles outbreak, then that means that less are going to, like, if a foodborne outbreak is happening, or trying to find out if a pertussis case has been near newborns or pregnant women or something, right? So it very quickly becomes the main thing that is happening, because it's so time sensitive and so contagious, and like I said, a number of people need to be quarantined and things like that. So it can get very involved, very expensive. Oftentimes in measles outbreaks, the CDC comes in to help with staffing, because it is so overwhelming for public health departments. And I know that happened in Southern California. I know it happened in Ohio the year before, during that measles outbreak also.
Yes. Well, that's great. Some real life experience being discussed here on the radio show today. Erin, I got about 1 minute left with you.
Okay.
Could you, as a professional nurse, as a professional infection control specialist, what would you tell my audience concerning the MMR and the quote-unquote link to autism? What would you say in 1 minute?
In 1 minute, I would say that's been totally debunked. There were various theories about it, like, was it the mercury in it? Was it too many vaccines? Was it a GI thing? I would recommend an article that's very interesting called Vaccines and Autism, A Tale of Shifting Hypotheses, that was in the journal Vaccines by Gerber and Offit, published in 2009. In a minute, that's what I would say. Look up that article, Vaccines and Autism, A Tale of Shifting Hypotheses. It's very interesting.
Very good. All right. Well, thank you again, Erin Archer Kelser, for your time and expertise, ma'am, and I hope to be talking to you again soon.
Wonderful. Thank you, Robert. Have a good evening.
You too, ma'am.
Bye-bye.
All right. Well, running out of time on the Outbreak News This Week radio show, and let me see if I can squeeze something in real quick. To piggyback on what Erin was talking about concerning how contagious this is. There's a thing that researchers use called R0 or R0, and it kind of refers to how many other people one sick person is likely to infect on average of a particular disease. And to put it in perspective, Ebola the number was 2, Zika is 3 to 6, HIV is about 3, seasonal flu is about 1.5, norovirus is about 2, measles is about 11 to all the way up to 18 people are likely to get infected from one sick person.